Welcome to Black Health News, and indeed, Black Health matters. Black Health News brings honest, accurate, and frank information on the health status of blacks in America. This video will provide an overview of blacks and chronic diseases. Of all the forms of racial inequality, injustice in health is the most shocking and the most inhuman. Quote from Reverend Dr. Martin Luther King, Jr. Research has long shown that black people live sicker lives and die younger than white people. A recent study, published in the Journal of the American Medical Association, JAMA, casts the nation's racial inequities in stark relief, finding that the higher mortality rate among black Americans resulted in 63 million excess deaths relative to white Americans over more than 2 decades. Because so many black people die young, with many years of life ahead of them, their higher mortality rate from 1999 to 2020 resulted in a cumulative loss of more than 80 million years of life compared with the white population. The study showed, cited by Liz Sabo, KFF, Health News Blacks, and Chronic Diseases African Americans are on the bottom of nearly every health indicator, including infant mortality, maternal mortality, injury fatalities, homicides, chronic disease rates, life expectancy, and death rates. Blacks suffer disproportionately from chronic diseases that are non-infectious medical conditions with persistent negative effects that can be both disabling and result in premature death. Chronic diseases are long-lasting or recurring conditions that can be prevented, managed, reversed, but in many instances not cured. They are generally caused by risk factors that's genetic, behavioral, socioeconomic, or environmental. For well over the past 40 years, the U.S. government's Center for Disease Control, CDC, has released reports on racial health disparities year after year, showing the pervasiveness of chronic diseases in black communities that after decades continues to worsen. The more than 40 million African Americans who live in the U.S. carry a disproportionate share of the nation's sickness burden. Sociologist David R. Williams, who has written extensively about the black-white health disparity, has repeatedly shown that African Americans not only have higher rates of sickness than whites, but they also get sick earlier, have more severe diseases, and are more likely to die from their diseases. Black people have higher rates of death than whites for 13 of the 15 leading causes of death. Quote from Shirley Hill, current top 10 leading causes of death among blacks. 1. Heart disease, a rate 226. 2 out of every 100,000 deaths. According to recent 2024 data from the American Heart Association, 60% of black American adults have heart disease, and heart disease death rates are highest among black Americans compared to other racial and ethnic groups. Black men have a 70% higher risk of heart failure compared with white men. Black women have a 50% higher risk of heart failure compared with white women. The Center for Disease Control reports that black Americans were 30% more likely to die from heart disease than white Americans. Heart disease develops at a younger age in black women and men than in white adults. 2. Cancer, a rate of 167. 4. Out of every 100,000 deaths. According to the Centers for Disease Control, black and white women are diagnosed with breast cancer at about the same rate. Black women are 40% more likely to die from the disease. Black men are twice as likely to die of prostate cancer and 2.5 times as likely to die from stomach cancer as white men. 3. COVID-19, a rate of 136. 4. Out of every 100,000 deaths, according to the National Institute of Health, blacks are more likely than white Americans to have symptoms of post-COVID syndrome, COVID long hauler. Post-COVID syndrome includes general symptoms as well as respiratory, cardiovascular, neurological, digestive, and other symptoms. 4. Accidents, injuries, a rate of 79. 6 out of every 100,000 deaths research shows that during 2020-2022, blacks died over twice the rate of whites from COVID-19. According to the National Safety Council, blacks experience a passenger vehicle fatality rate 73% higher than non-Hispanic whites. Blacks experience a pedestrian walking death rate 118% higher than whites. 5. Stroke, a rate of 59. 6 out of every 100,000 deaths. According to the Office of Minority Health, blacks are 50% more likely to have a stroke, cerebrovascular disease, as compared to their white adult counterparts. Black men are 70% more likely to die from a stroke as compared to whites. 6. Diabetes, a rate of 46. 3 out of every 100,000 deaths. According to the Office of Minority Health, blacks were 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. Blacks were 60% more likely than non-Hispanic white adults to be diagnosed with diabetes by a physician. 7. Homicides, a rate of 33. 7 out of every 100,000 deaths. Current data shows that black Americans are 10 times more likely than whites to die by gun homicide. 58% of all people killed in firearm homicides are black. Black communities are disproportionately impacted by gun violence. Black people are nearly 3 times more likely to be shot and killed by police than white Americans. 8. Chronic lower respiratory disease, CLRD, a rate of 27. 9 out of every 100,000 deaths, CLRD, consists of bronchitis, emphysema, and asthma. According to the Office of Minority Health, blacks were almost 3 times more likely to die from asthma than whites. Black children had a death rate 7, 6 times that of white children. 9. Kidney disease, a rate of 26. 5 out of every 100,000 deaths. According to the National Kidney Foundation, blacks are more than 3 times likely to have kidney failure compared to white Americans. 10. Alzheimer's disease, a rate of 29. 4 out of every 100,000 deaths age 65 and older, according to the National Institute of Health, 18. 6% of blacks are diagnosed with Alzheimer's disease compared to just 10% of white Americans. Blacks ages 70 and older, 21. 3% are living with Alzheimer's.